Good morning and welcome to Community Connections with Children's Services Council of St. Lucie County. I am just one of your ultimately remoting host, Sean Boyle, and with me is
Ashley Mock. I
and
feel you haven't changed your talking with your hands.
no, and I've knocked the light over. If anybody's ever watched any of the past shows on Facebook or show the video, I've actually hit the light.
The
But yeah,
microphone. I
I've hit the
got it.
microphone. I've made an earthquake on the screen. Yes. But welcome to the half hour radio. And because in a pandemic, we are not allowed to be in rooms together talking and spreading particles everywhere, we have been doing it via Zoom. So we've been actually rebroadcasting the radio program via video form on Facebook every Sunday at 11 a.m. But this show, what we concentrate on is connecting you, the listener, and viewers, I guess, to what resources and things that are available for children and families in our great community we call St. Lucie County. Now, we at the Children's Services Council, I think we've gotten better at being Zoom operators than radio people. But what we do at the Children's Services Council, besides stumble through this radio show for the last 9 years, is 5 things for our community. And those 5 things are: 1, to make sure every baby's a healthy baby; 2, to stop child abuse before it happens; 3, to keep kids off the streets; 4, to keep them in school; and 5, keep them off drugs, alcohol, and other risky behaviors by offering programs and resources for all families, even during a pandemic in our great community.
Especially during a pandemic, I feel
Absolutely.
But so Sean talks about those priority areas, and the best way that you can get information about the programs that we work with, and I'm going to say, and resources that you might need, especially during this time, is on our website. We have a long list of our funded program partners there, along with contact information for each one of them. And we also have a page where we are compiling COVID-19 resources. So anything that you might need, I know we're going to talk a little bit more about a couple of them today, but there's information there from local places, the state, the federal government, all of the things that you can think of. We are working hard to make sure that it is sort of an exhaustive list of resources for you. So please visit our website at cscslc.org. It's also a good place to stay up to date on information that we're sharing about things that our programs are doing out in the community. So the website is excellent. Facebook is another good place to find some of that information. We don't share probably everything that's on our website on our Facebook page, but Facebook is also another good place to kind of stay in touch with what's happening, what the programs are doing, other resources that you might not be familiar with. It's just a good place to get information about what is local.
And I know one of the things that we just added, and I should say we were recording on a Thursday. I say that
Yeah.
because I just feel the need to let everybody know, because the world changes like every
Day to day.
6 hours. So, but we just added the resource of the county with the CARES dollars is able to help with rent and utility assistance and some other stuff, which is great and phenomenal. And our county, is going to execute that out through themselves or through their partners. But all that information and the contact information is on there. So we know one of the big issues, obviously, with the pandemic, and I feel like I'm stating the obvious, besides the risk of catching the virus, is the economic issues that its impact has had. And so this is a great way to help mitigate some of those impacts for families directly.
One of the new things that's also on that page, I just wanted to point out, and we shared a little bit about this on Facebook this week as well, is the library and what the library is trying to do to sort of overcome some of the challenges that they're obviously experiencing, since people aren't really going to the library. But they have done some really cool things. They obviously have the summer reading challenge that we've partnered with them on for several years. But they are also doing grab and go bags for kids. So they've got crafts and other activities that are paired with a book that you can just pick up from them. They're also doing curbside pickups, so you can call or go onto their website and hold books that you're interested in and just drive up and pick them up from them. So there's more information on our website about that on that COVID-19 page. But it's just, everybody's kind of having to change their sort of delivery method for their services. And I think the library's done a really good job of trying to make sure that they can still have things available to our residents.
You know, I'm a big fan of our library system,
You
and I really became a big fan once I realized that you can do a lot of stuff digitally. So you can get a library card, and then you can go onto the library's website and you can download books and music. And so in times of stress, I don't know if you experienced this, Ashley. In times of stress, you're sitting home, maybe you go on your phone. So instead of like going to Amazon and be like, oh, I stress bought, four things that I don't need.
How did
I
you know that's what I was
I
doing?
I just, and I don't know if any of our listeners can relate, but so sometimes what I'll do, because don't get me wrong, I still fall into that occasionally, but I'll go to the library and I'll, if I have that urge, I'll be like, oh, let's see what new books they've got, or let's see
Hmm.
what new music they got, and it's kind of like it's itching that little stressor without actually impacting my wallet. So
That's very smart of you.
so
My wallet could use some of that,
so
some of that help.
the other thing that I want to bring up real quick is we did in fact start our Rising Star Saturdays. So if hopefully you've seen that advertised, particularly if you're on Facebook, and let's face it, you probably are. Where we have 6 locations. Our providers are open on Saturdays at different times to help facilitate, quite honestly, to give parents a respite, but also to facilitate some summer learning, because they all have computers and technology, and the school district has a wonderful online virtual stuff that kids can be self-guided through, or guided through. Uh, so that has taken off now. It's 4 consecutive Saturdays, but just because you missed the first Saturday, it's not necessary that you go to all 4. You can come in and out whenever you please. But please check that out, because we want to make sure that we're giving as much, I'll call it education booster shots, if you will, to our kids prior to them returning to what is going to be a variety. It's like that box of chocolates. You got options here, school year.
Something for everybody. I will say on the Rising Stars page, which again, you can find right from the homepage of our website, but there are phone numbers for each of the locations listed, and they are asking for you to call if you are coming so that they can adequately prepare for social distancing and all the things that they need to do. So there is a phone number for each location on there, but they are asking that if you are planning to send your child on that Saturday, just give them a heads up so they know how many kids to expect.
Yeah. And we should also say, because we usually talk about this every week, just that I don't want to say dialing back. That's not the right word, but we're not doing it every week, the small business big challenge, but we are still doing it.
Yes.
So this past week, we did Taco Dive. I love that place, Taco Dive, and Tykes and Teens, and we're going to continue it, but we don't know if we're going to do it week to week. We might go to once a month or twice a month, and really part of the reason why we did it was to make sure that small businesses were still getting customers, and that doesn't seem to be as big an issue. But again, we're recording on a Thursday. The world's going to change by the time you see this. So we
There's
may
no telling.
fluctuate in and out between weekly to twice a month to once a month. But I just want our listeners, because we always talk about it, to know that we are still, that is still top of mind, not only to help our nonprofits, but also to help the business community, the small businesses. So we're still, it's still in our minds. It's just maybe not happening as often.
Yep. Yep,
Okay,
for
so
sure.
before we get to the guest, I mean, did you really think, folks, that we're going to get out of this show without me saying, fill out your
No,
census? Fill out your
I didn't.
census. Can we just say that? Like, if
That's
you're
it. That's
watching
all you
this
have
and
to
you're like,
say.
what's a census? Then call me, 237-1130. But if you haven't, you know what I'm talking about, you haven't filled it out, I almost have no words for you. Like, please
No,
take the
there's
3
no
minutes.
excuses. There's no excuses anymore. And I think too, there maybe prior to March, there might have been some questions in people's minds about, is this really important? Do I really need to do this? But I can assure you that in the state that we are in currently,
Yes.
um, the having an accurate count of the number of people who live in your town, in your state, is going to be super important. And we need to make sure that in order to get the resources that we need to benefit our community, that we have an accurate number of the people who live here. And that's what happens with the census.
Look, here's the other deal, folks. We know, because we get some of the emails about what they're, hey, encourage people to fill it out. This is what we're doing next. They're starting to train people to come
They're
knock
going to
on your
come here.
door if
They're
you
going to
have
come
not
knock on
filled
your
that
door.
out. And I don't know about you, but if I don't know them, and they knock on my door, I'm like, can I help you? What do you need? Like,
Yes. So what we're trying to avoid that for you. All you have to do is fill it out. That's it.
all right. So this has been fun, actually. So
Hey, that's what we're here for.
I always enjoy having these conversations with you. All right. So let's let in our guest.
She's waiting patiently and not at all nervous about joining us today.
Yeah, she hopefully is not nervous, and she's hopefully, oh, there she is. Okay, good.
She's not nervous. Oh, you thought she left? Maybe
I know she might have been like, the nerves got the best of her.
Was there.
The nerves got the best of her. She just said, I'm leaving.
Now, we have talked about, I feel like it's been maybe 5 or 6 weeks ago, but you told a story on the radio show about someone who we knew who was working her little tail off when all of this started. And I think you mentioned that she had worked like 16 days in a row without a day off. And that, of course, is the lovely lady that has joined us today, who I don't know what your current record is at now, Sonya, but
Me neither.
how many
We've lost count.
We always joke that we can never get a guest on Sunday because nobody wants to work on Sunday, but clearly we could have had Sonya the whole time.
The whole time. Just working every day. So Sonya Gabriel's with us today. She is an employee of the Department of Health here in St. Lucie County. So she has obviously been very, very busy for the last few months. But one of the things that we're going to talk about today is not related to coronavirus. Thank goodness. I think you probably need a break. So.
That's why she agreed to do the show.
Yeah, right. But I know from our work together that one of the things that's always been near and dear to your heart is babies and the state of our babies that are born here in our community. And I know we've got kind of maybe a long and winding road of how we got to the program that we want to talk about, but can you give us a little background about kind of the conversations that have been happening in our community in the last few years and kind of how we got to this program that is new for us?
So, good afternoon. Hi, everybody. Good to be here. Thanks, Sean. Thanks, Ashley, for having me on and the opportunity to talk about the Sisters Empowering Sisters doula program. So just to kind of give you some history and background on how we got to where we are today, around 2014, 2015, we were looking at the data on our infant mortality and discovered at that particular time a very significant disparity in our Black infant deaths compared to our white infant deaths. And around that time, it was almost 2.5 times greater. So again, the disparity issue amongst white deaths, infant deaths versus Black infant deaths is not unique to St. Lucie County, nor to Florida. It is a national issue that is discussed all the time. But when we looked at our data locally, it just did not sit well with us to see that kind of a disparity. And just to give you some raw numbers, in 2018, I believe we had in 2015, we had 18 infant deaths. And 15 of them were Black infants. So right there, it just, even though the numbers are relatively small, like 18 out of 3,000 roughly, is really small. But however, when you look at, that's 18 lives. 18 lives that could have been.
Well, and frankly, one's too many, right?
Exactly. And 15 of them being Black infants. So the question we have to ask ourselves is, why so many more Black infants than white and Hispanic infants? So what we did is we modeled after the national FEMA process, which is the Fetal Infant Mortality Review Program. And we modeled it after the national FEMA process, and we hired a nurse to do just that. So what she did for 2 years is reviewed the cases of those infants that had died between 2014 and 2016. Roughly 30-something cases were reviewed, primarily with the focus on being the Lincoln Park area or the 47 and the 50 zip codes.
Because that's where, just to clarify, because that's when you looked at the deaths, that's where the majority were coming from.
That's correct. That's where most of them was coming from. And it would have been lovely to have a nice picture painted as to these are the reasons why infants are dying. and there is no clear-cut answer on that, but after doing some case reviews, after getting input from several professionals in the community who work in the field of maternal child health, we did come up with sort of 3 areas to focus on, if you will. And those 3 were prenatal care, so to improve prenatal care, to improve community education, and to improve on our safe sleep activities, or so we can prevent the unsafe sleep deaths. And if I could just back up a little bit too and go back to the data, we did a comparison of not only the Black versus white infant deaths in St. Lucie, but we looked at the Black risk factors in the Lincoln Park area for Black mothers compared to Black mothers in St. Lucie County. And I'm just going to read off a list of those factors that we found that were higher in the Lincoln Park area compared to the rest of St. Lucie County. One is low birth weight. So Black mothers living in Lincoln Park had a higher chance of having a low birth weight baby than a Black mother living somewhere else in St. Lucie County. They were also at higher risk for preterm birth. They were at higher risk for having C-sections. They were at higher risk for entering care late, so in their second trimester versus their first trimester. 85% of the mothers in the Lincoln Park area were single mothers, which I find, to me, that stuck out. So when you talk about somebody who is a single mother, you have to look at support. Who do they have in their life that can support them? And that'll come into play in a little bit later when we talk about the doula program.
Well, hearing that even, and I'm sorry, I was taking notes.
No,
So one of the things that we track as our indicators, we obviously track infant mortality, but we also track access to prenatal care and early and late prenatal care. And being what you said about single parents, that becomes a time and issue. And I now I kind of understand why that might be.
Right.
Sorry.
And not only that too, but I don't know if I want to call it an opportunity, Sonya, but I had the chance to sit in on some of those early conversations, and there's a lot of other factors that play into maybe why those moms aren't accessing care, and it's transportation, or it's they can't get the time off of work, or like you said, they have other children at home, they don't have someone to watch those children so that they can go to an appointment. So there are a lot of compounding issues outside of just those ones that we're identifying. Right.
It's not just go to the doctor, make an appointment and go. You and I can do that, but for those mamas that don't have those other support systems in place to do that, who's going to watch their kids? How are they going to get there? How are they going to fill their gas tank to get to the doctor's office if they live in Northport Pierce, but their doctor lives in Southport St. Lucie? Right. That's a good 20-30 minute drive one way, and that's time, that's money. Those are the challenges that our moms are definitely are having. There is a slightly higher rate of BMI, which is body mass index, for the Black mothers that live in Lincoln Park compared to the rest of Black mothers in St. Lucie. There is a higher rate of repeat teen birth in the Lincoln Park area, and a lower rate of breastfeeding initiation in the Lincoln Park area. So, having said all that, what we decided to do here in St. Lucie to kind of spearhead this is to start a community-based doula program. So a doula is...
Wait, let me back you up real quick, because I'm going to fill in a little details from our end. So we had a staff member, a team member, I should say, that participated in the fetal infant mortality review, FEMR. I think I got that right. And
you did.
And so when we looked at the numbers, we know overall the infant mortality is below the state rate, but we knew of because of the fetal infant mortality and because of your work and everybody's work, we knew about the discrepancy, or we found out about the discrepancy. And then you guys did the FEMR, and then for us, you know, we offer, and we've talked about it 100 times on the show, we offer a system of care between Healthy Start with the prenatal care to the nurse home visit, to the brain visit, to early steps, to healthy kids, all that. And what we found was poor utilization, or I'm sorry, not poor, low utilization at Lawnwood. So we kind of already knew that flag, you know, that caution flag was there.
Mhm.
And then when you did the femur, we were like, look, now that we know, we as a community and we as an entity, Children's Services Council, can't just be like, well, sorry, you know, it is what it is. So we put out an RFP to say, hey, this femur identified the strategies and the issues. We want a response to help the mothers in the Lincoln Park area. And that's where the doula program came. Sorry, I just wanted to fill that in because it didn't just
Thank
be
you.
like, I just wanted to fill that in and let everybody know, because we have been talking these last few shows about equality and equity and justice. And I feel like this is sort of related to that because, you know, some of that is, you know, are there systems in place? Are the systems serving everybody? Is there an avenue for everybody? And we found that our system, there was roadblocks. And so we partnered with you, and partnered in that we help fund, you do all the work. We partnered with you.
That's a lot of work too, Sean. Don't shortchange yourself.
to bring this about. Sorry, I just wanted to fill that in. So okay, so explain to everybody what this is, what the program is.
So a doula is nothing new. It goes all the way back to the beginning of mankind, and it is someone who provides continuous support. In this case, we're providing birth doula support. You can be a birth doula, you can be a postpartum doula, and there's even something out there called end-of-life doula, which is nothing related to mother-baby. It's the other spectrum, where when someone is dying, you have a support person who's there with you constantly. In this program, the Sisters Empowering Sisters Doula program, we've recruited 3 women from the community, 3 Black women who have been trained as doulas from an internationally based doula organization called DONA. And we've used those women to work with the Lincoln Park women. So the referrals will come into me, they'll get assigned to one of our doulas, and then that doula will then begin establishing a relationship with the mom prenatally. Now, in the best case scenario, and again, this is all free. That's important to tell the mom, this is free, and they're coming to the mom. So wherever the doula can meet with the mom, whether it's in the home, whether they're walking down the street or they're going to the grocery store. I mean, I've kind of seen a few examples of this happening already with our doulas, where they'll meet at the marina, they'll go to the grocery store at Publix, and that's where they'll do their visit. Again, this is doing real life with real moms, you know, so the doulas are being just as real with being able to be accessible to them. And so in the ideal setting, the doulas will do monthly prenatal visits. And in that final month of pregnancy, it'll increase to weekly visits. And during those visits, they're establishing relationship, establishing trust. This is a pretty intimate time in a pregnant woman's life, so she wants to be able to have someone there who she can trust. And so the doula will do education with her on prenatal care, labor support, pain measures, comfort measures. And then I've kind of added a second layer to that. Haven't really officially dubbed it anything, but you could call it almost like a community outreach worker as well, where they've been trained in all of the different programs that already do exist, related to maternal child health and a few other social service agencies, because they're another set of eyes and ears in the home. And they're developing that trusted relationship with mom. And as mom opens up, the doula can then identify other needs that mom might have and say, oh, you know what, I know about this program I can get you plugged into. If she's not getting consistent prenatal care, she's another advocate who's there to encourage her, make sure you're getting consistent prenatal care. Doulas are not medical in nature. They're they're lay people. And so everybody stays in their lane, but they're all part of the care team as far as getting moms to have an optimum pregnancy and healthy birth outcomes. And then once mom goes into labor, then the doula presents herself to the hospital for the most part. Most of the moms that we're working with end up having hospital births. We've had a few that have had home births. And then the doula, by nature, her role at that time is to provide continuous labor support from the time that she arrives until about 2 hours postpartum. So in some cases, which has happened, some births have been as little as 5 hours so far, and some have lasted 2 days, 30 some hours. And that doula was there the entire time.
Wow.
And you can't speak enough to the strength of having somebody present with you when you're going through something very stressful. No matter what life situation it may be, in this case, there's someone having a baby, someone is pregnant, and she's going through childbirth. This is very significant. And so the stress is obviously high at that point, in addition to the stress that the mom already has. When I mentioned some of those other issues when it comes to access to care, she's a single mom and all those other stressors there's a lot of stress that mom brings. So the doula can help quiet some of that stress. Isn't going to necessarily remove it, but is just going to support that mom. And studies have shown that even if a doula sat in the corner of the room while mom was giving birth and did nothing else but sit there, the mom would rate her birth experience as much higher than if she had nobody with her at all. So our doulas have been trained to provide a lot of that prenatal education and support, and certainly are trained in how to provide comfort measures during mom's labor. I'm really happy to say that all 3 of our hospitals, Lawnwood Regional Medical Center, St. Lucie Medical Center, and Cleveland Clinic Tradition, have just been 100% supportive of having our doulas participate in their hospitals. There's been no barriers. They've just been very receptive in having them there. There's been no issue. And I just wanted to put a shout out to them because, again, this wouldn't work unless we had support from the hospitals.
Well, and that, I know that we've had conversations, especially in those early FEMA meetings, like the questions about maybe cultural differences when a mom shows up to the hospital, or maybe judgment that she might feel because she was, maybe she didn't have the best prenatal care and she felt judged when she got there to deliver the baby, or whatever situation it might be. So I can absolutely see how having someone in your corner for longer than 24 hours is hugely impactful for them, because that person knows you and knows your situation and can advocate on your behalf. And that for some people is really empowering.
Right. And it helps. They don't speak for the mom, they help her find her own voice. So they provide not only the physical and the comfort measures during labor, but they are also providing her informational support, and they're advocating for her. So I'll give you an example. If the doctor or the provider walks into the room and says, "Mom, we need to do XYZ procedure at this point." If this is a mom who typically would just say, okay, and not, have a voice to say why, what the doula can do is, "Mom, Dr. So-and-so has just said that we need to do whatever. Do you have any questions?" And at that point, the ball is now in mom's court. The mom can say yes or no, but now she has the voice to say, "Yeah, I don't really understand what you meant by that. What do you mean by whatever the intervention may be?" And I'm happy to report that of all the moms that we've had deliver so far in our program, most of them they've avoided having a C-section. Most of them are breastfeeding their babies. So when we're talking about improving birth outcomes and lowering infant mortality rates, those are some of the things we look at. We're having a lower C-section rate. We're having an improved breastfeeding initiation rate. And 100% of our babies, as I'm happy to say, 100% of our babies are all born at healthy birth weights. None of them were low birth weight. And none of them were preterm.
Awesome.
That's great. We have a minute left, and this happens.
That's it?
We'll if you're watching us on Facebook or if you're listening to the radio, we're going to I have a couple of questions what we'll do in the after show. So that's an enticement for you to jump onto Facebook at 11 o'clock to watch a replay of the show if you're listening on the radio, but then we're going to do an after show, a brief conversation. But real quick, before we end the radio show part, can you tell everybody how they can learn about it and or I'll call it get enrolled for lack of a better way to describe it.
Yeah, so it's really simple. They can call me, 772-462-3955. That's the best way.
All right, say it one more time, a little bit slower.
772-462-3955.
All right, that is the end of our radio show time. And again, if you want to catch the after show conversation, if you're watching on video, it's going to be coming right up. If you're listening on the radio, jump to our Facebook page at 11 and you can catch the rebroadcast as well as the after show. But this is exciting, and I'm excited that, I feel like this is a reflection of our community. You know, you as you mentioned before, this disparity is nationwide. It's definitely statewide. And we're fortunate to live in a community that has the resources and the committed partners to say, you know what, this is unacceptable. We're going to do something about it. So thank you, Sonya, I know this was your brainchild. Thank you for doing just that. All right, folks, it's a weekly radio program every Sunday at 10 a.m. on 104.5 The Flame. Also a Zoom show as long as we can't be in the same room together. So remember, it's our children, our community, our future. Now more than ever, we're all in this together. We'll see you next time. All right, so if you stayed with us, awesome. This is the after show because we have a couple, we got so enthralled in the conversation. We have more we want to say and ask. So
there's never enough time.
There's never enough time. But
No.
this is actually working well until we stop doing this, and then we'll have to just talk faster. So, Sonya, the idea of the doula. Let me use the nurse home visitation as an example. The nurse home visitation program that we support and fund, a registered nurse comes to the home within 1 week of them having delivery, whether it be at the hospital or wherever it may be. I can see, before when we were talking the intro to the radio show, we talked about the census, like fill out your census so nobody comes knocking at your door, because who wants to have a stranger come into your house? So I can see that as an obstacle for families. Like if I don't know you and I'm just back from the hospital, I know you're a nurse, but my house maybe is not the cleanest
Right.
And so as part of the doula, I like that they're from the community. Hopefully they know the community well, but I'm assuming part of the role of the doula is also to kind of, I'm going to say vouch for lack of a better word, but to be like, hey, my friend, the nurse from Lawnwood's coming by and you need to make sure that, you let her in. She's cool, basically.
Yeah, so like you mentioned, there is already an existing continuum of care for moms and babies. And this is just another added service that and I always want to remind people, we are not a standalone siloed program. We are a program that is here to enhance the existing continuum of services that we have. So when our doulas are working with our moms, it's an opportunity to say, hey, listen, don't forget that when you have your baby, there's going to be a nurse, and whatever hospital it is, we'll name those nurses. She's going to be calling you. Actually, she's going to be seeing you before you leave the hospital, most likely. And then she's going to be knocking on your door to say, I'm here for my visit. That's the nurse. That's the visit that you want to open your door to.
Right. Ignore the census guy.
Don't ignore the census guy. No. Well, and
that's the person you want to be coming to your home. Right. Who wouldn't want someone to come and check up on you and your baby?
Yeah, I've shared this story. I've shared this story before with Ashley, probably on the show. And I remember my oldest, who's now, I keep saying my kids are 19 and 22, but they're really 20 and 23 when I do the math. My 23-year-old, I can remember, she came a month early. We were in Chicago. She came a month early, and I don't know how else to put it, but we weren't just quite right that first couple weeks. We were over paranoid. It was hot as heck in our house because we thought the baby would be cold, and so I think I would have welcomed somebody to come in and be like, you don't have to be this paranoid about the temperature and stuff.
It's warm. I think
so,
it's okay.
Yeah.
So that's good
Yeah.
that visit is available.
Yeah, and our doulas are also providing support up to 2 months postpartum as well. We can't forget the fact that just because baby's born, that's kind of the end. We've made it to the end, to the finish line.
That's just the beginning.
In retrospect, that's the easy
Right.
part.
And especially for mom now, the hard part is just beginning, where she's dealing with all the emotions and, again, she might be a single mom who's now dealing with a new kid. So just having somebody there, that doula there, who can bring in other support services, who can provide that emotional support and say, yeah, you can do it, keep going, giving her that education, continuing to encourage her to breastfeed. We have a really great breastfeeding initiation rate, but then it starts to drop off after a while. So what we wanted to do is to continue that long-term breastfeeding relationship with mom and baby, where the second part of the program would be to introduce 2 additional women from the community who've been trained as breastfeeding support counselors, who will help those same moms continue to breastfeed for at least 6 months or longer.
Phase 2.
We're looking at 6 months.
Phase 2. So actually, I'm glad that you brought that up, because Sean talked a little bit during the show about how we got here. Like we knew this was a concern in our community, and the Children's Services Council put out an RFP to say somebody fix this problem. But you did a lot of research before this program was actually the one that you put forward as the solution to the problem. And I know that was, there are other communities that have tried to address the same types of situations. Why did you think that this was the right fix for us?
Well, a lot of it, was data-driven and research-driven. So obviously there was some proven strategies behind it. But also having that experience working in this community as a nurse doing the home visits, it's so much better well received coming from someone who looks like the community. That's the whole premise of community-based, is it's someone from their community who looks like them, talks like them, believes like them, understands their background, their culture, their values, and can use that in bringing that supportive environment to the pregnancy and the postpartum period. I'm not going to say it doesn't have its challenges. It hasn't been easy either. There's still some access issues, if you will, some trust issues. It's not just because these women are women of color that the door is just immediately open. There is still a lot of work that has to happen to gain that trust. But I think being culturally relevant, especially now with all the things that are happening around us, we've got to be very, very intentional about how we deliver services, especially in how we are trying to address the equity and the disparity issue.
You said something that I wrote down. I want to make sure. So the doulas, when obviously they work with the moms, that seems pretty obvious, and I can't believe I just stated that. But for those households that maybe there is a mom and dad, or a future mom and a future dad to be, are they also working with the fathers?
Yeah, absolutely. Again, it's not exclusive to mom, and the doula never replaces the spouse or the baby, the father of the baby, whomever that other support person may be. They never replace them. So if they're there in the hospital together, they're there as an entire unit. And the doula will help dad, let's just use him as an example, will help dad help mom during her labor.
Right.
The doula doesn't have to be all hands-on with mom. She'll teach dad how to be hands-on with mom.
I asked that because obviously being a dad, I'm particularly not concerned, but I have that thing, because what I've realized at some point, some of the services for new moms, they're, hey, can I come by at 8:30 a.m. on a Tuesday? And my reply is, are you trying to involve the father or not? Because if you are, then 8:30 on a Tuesday is not going to work for
Right.
the whole family, if that's truly what we're trying to do. So I'm excited to hear that. I in this after show part, I wanted to ask, so the name doula, like I can imagine, and I think there's like a body part that has the word doula in it, right? That thing that hangs down from your throat. Anyway,
It's in your brain. What are you
sorry.
talking about?
Oh yeah, maybe that's it. You know, and me, it's in my mouth. Or I just don't have that part. I mean, I got to imagine that probably takes a decent amount of, you know, because most people don't. Like, I remember when I heard about the doula, I was like, oh yeah, I've heard about that before. Don't ask me to spell it, but I'm not 100% sure what that is. I would imagine there's some community education that has to take place with that name. And or have
There
you thought
is.
about just saying, hey, maybe we call it like, we're your birth champions. I don't know. That doesn't sound any
I
better.
think with most people, we do have to explain, unless you're in the maternal child health circle, then yeah, we do have to explain what the word doula means. And we usually define it as a labor support coach or a labor support person, someone who's going to be there with you the entire time.
Right. It's a champion. It's a champion for the
Yep.
mom and the newborn and obviously the father.
Yeah.
That's awesome. We'll have to think of some creative
something you
names.
said, Sean,
I
Birth-
like baby
about the
champion
Father's
is
Day.
really good. I don't know.
Say that again?
Baby champion. I like
champion?
that.
Yeah, but we want to make sure that the baby and the mom are the champions. So it has to be like, I don't know.
He's going to think about this for
I'm
far
going to
too
dwell
long.
on this for a while. And I'm going to email it. And you're going to be like, Sean, the program's called Doula. Like, stop.
I'd be like, try again.
Nope. That's a no.
Well, hey,
I know.
Oh, go ahead.
Yeah,
Ashley, I'm
I was
sorry.
going to say thank you. I know, again, I feel like sometimes there was a lot of information that I absorbed in those femur meetings that sometimes was not pleasant, I'll say pleasant. And it did identify a lot of challenges. So I think the fact that as a community, we had people from almost every walk of the maternal world come together to address this issue and to figure out how we could move forward. And like you mentioned, you know, we do have a continuum of care, and at the Children's Services Council, that's what we tried to put together. But once this was identified as a piece that might be missing from it, we all really collectively, I think, said we have to fix it. There has to be something that we can do. So I really applaud you for coming up with this plan and putting boots on the ground, if you will, to really start taking a hard look at what we can do to level the playing field for all of our moms.
I appreciate that. And I did have a lot of help from colleagues who've done this in other parts of the state. Without their support and without their consulting experience, I would not, you know, I did get kind of up and running, but there was so many people, so many organizations that helped put this together. And you know, I guess my next sort of organization to get into is the faith community. And I've been able to get into a few churches, and we really just need to, you know, work with them closer, because they really do have the pulse of this community at times. So we really just need to
educate them about the program, right?
But the program and some of the issues that our moms and babies are experiencing. I mean, I did speak on a Sunday morning, get that, me, on a Sunday, invited to speak from the pulpit from one of the churches up here in Fort Pierce. And
that's great.
I was able to touch on some of these major issues on safe sleep and infant mortality and the doula program. And you can see a lot of light bulbs, because people were just not aware.
Yeah.
Well, and I think that's the whole purpose of the show. And I know we're in the after show part, and we probably really should have emphasized this more in the first part, but you know, like, now that you know this information, the viewers and listeners, you know, pass it along. I mean, you may not live in Lincoln Park, or you may not be expecting or plan on being expecting, but if you know people that live there, talk about the issue, let them know about the resource, because, you know, we can't use not knowing about resources as obstacles anymore, because we all have, and I say we being the three of us, but everybody watching and listening, to know, even if you don't know the exact number and who to refer to, at least say, oh, hey, I heard about this. You know, there's somebody named Sonya at the health department, or, you know, I saw Sean and Ashley talking about it, so let me message them or go to a website. But, you know, the more informed that we are, the more educated, the more empowered, the more that we can eliminate these discrepancies. So So thank you, Sonya, for coming on, sticking
Thank
along
you.
for the after fun part of the show.
Yeah.
The
Before
show
we
after the show.
before we sign off again, I want to make sure that you give out your number. And what I'm hearing you say is if somebody has a group, whether it be a church, I mean, obviously safely, a group that gets together, you can obviously educate people about this as well.
I can, and I've done it several different places. So if anyone is interested in hearing more about the Douala program, how they could be involved, how they could participate, how they can refer, simply just call my number at 772-462-3955.
Awesome. Thank you.
Thank
We appreciate all that
you.
you do. And
Thank you,
a
guys.
big shout out, because I know, as Ashley led in your intro, I know that everybody at the health department is putting in long hours, and it seems like it's probably doesn't seem like there's a light at the end of the tunnel anytime in the near future. So just know that, you know,
I don't know.
we are very, very, very grateful, not only at the CSC team, but I think for the whole, speaking on behalf of the whole community, for all the efforts that everybody at our health department is doing, and you guys should be quite proud of the work that you're doing.
Thank you. We appreciate it. And I know that administration will be very appreciative too.
All right. Thanks, everybody. We'll see you next time.
Thanks.